Today we're going to be doing PRP, plasma injection to the scalp in a patient that is 3 weeks post-hair transplantation. This will be the second treatment. The first treatment we do at the time of the transplantation. In this particular case we did around 2,000 hair grafts into the frontal scalp and some into the vertex area. And there will be a third treatment done 1 month from today. So the PRP stands for Platelet-Rich Plasma. For what we do is we harvest the patient's own blood through the antecubital fossa here in the arm, and we collect about 8 cc's, which were then spun in a centrifuge, and that's what separates the platelets with the plasma from the rest of the cells in the blood. And we use those platelets and the plasma to infiltrate it like we just did into the superficial aspect of the scalp where the follicles are. And the reason to do PRP with the hair transplant is to continue to stimulate the hair follicles to stay in the anagen phase so that the results can actually start to be seen faster.